Times, the Cortez Journal, and the Dolores Star. Well, First Lady Michelle Obama is scheduled to speak here at Fort Lewis College tomorrow at 6 in the afternoon as the Democratic campaign seeks to woo voters here in the swing state of Colorado. Well, today we're going to speak with a woman who was chosen to introduce President Obama when he spoke in Denver in May. She's Tammy Graham, fifth-generation Coloradoan, a professional mediator. When Tammy Graham was diagnosed with stage 1 uterine cancer, she knew she couldn't afford the tens of thousands of dollars needed for treatment since she didn't have health insurance. That's when someone mentioned the high-risk pools established by Obama's Affordable Care Act. The insurance helped pay for Graham's hysterectomy as well as follow-up care. After Tammy responded to the Obama campaign's Facebook post seeking personal experiences about the Affordable Care Act, she was invited to introduce President Obama.
There I was, with cancer and without insurance. Through my local health department, I found out about a new program created by Obamacare. The pre-existing condition insurance plan.
That was Tammy Graham introducing President Obama in May. She also happens to have been, for years, the general manager of the community radio station here in Durango that airs Democracy Now!, KDUR. And she's joining us now to talk more about this underreported part of President Obama's health care plan that's designed as a bridge for people with pre-existing conditions who can't obtain health insurance coverage. We welcome you to Democracy Now! It's great to have you with us, Tammy.
It's great to be here. Thank you.
So, and it's great to see you in good health.
Yeah.
What always amazes me, because I have friends who have discovered this program, what is more frightening sometimes than not having the program, that you can actually get insurance without, with a pre-existing condition, is that there is such a program, but people don't know about it.
I was amazed in the medical industry. Not one person that I talked to in the last year actually knew about this pre-existing conditions plan insurance program. I was stunned. So
in New York, it's called the Bridge program, but okay. It has different names in different states.
Yeah, here in Colorado, it's called Getting Us Covered, and it's amazing. No one knew about it. I thought if anybody, the medical industry would. So it's great to be here to let people know about it.
So tell us what happened. You're diagnosed with cancer.
I was diagnosed a year ago, September, so 12, 13 months ago. Much to my surprise, I'm very healthy, I'm fit, 47 years old, didn't expect by any means to have a cancer diagnosis phone call. However, there I was, and so I went ahead and started scrambling to figure out how I was going to pay for the treatments I needed because I didn't have health insurance. I'm self-employed. So I called my local health department, and someone there, bless her soul, knew about the pre-existing conditions plan. She said, well, you might check this website, gettinguscovered.org. And so I did, and sure enough.
What's the website?
Gettinguscovered.org. And I was able to find out that I qualified. Basically, one just has to not have been covered by insurance for at least 6 months. You have to demonstrate that your employer can't provide you with insurance, which I'm self-employed, so can't provide you with insurance because of your condition, pre-existing condition. So that was easy to prove, and it was actually fairly easy to qualify and to get lined out. So as of November 1st, I had coverage.
What's so interesting I find about this program is that while insurance companies are famous for saying no to everything,
right,
this one, they accept and they want you to get accepted to. So even if you get rejected, they encourage you to go to advocates to rewrite a very simple form because they get fully reimbursed by the federal government.
Right. Right. So it's kind of amazing. I'm still kind of surprised that I was that easily able to get insurance coverage with a pre-existing condition, because you hear all the horror stories of, people going bankrupt and whatever it might be because they can't cover their medical costs in a situation like this.
So you got the coverage, and then where were you able to go for treatment?
I was able to go to the Anschutz Medical Campus, which is the CU Boulder Research Hospital.
That's Colorado University.
Yeah, Colorado University. Excellent hospital. Got outstanding care. Didn't have to skimp on anything in terms of my care or follow-up treatment. So, I'm fortunate.
What has been amazing that this has been in effect for well over a year,
right?
But that Most people in this country have no idea. There's still this thought that if you have a pre-existing condition, you might as well give up on getting any insurance.
Right, absolutely. I mean, I'm still, like I said, shocked. And like you say, the vast majority of people I talk to, people have no idea that any part of the Affordable Care Act has gone into effect, much less this, in my opinion, one of the most important parts of the Affordable Care Act.
Well, I want to thank you very much for being with us, sending out that alert information that could save many people's lives.
Absolutely. I mean, it could have saved mine, so I'm glad I didn't have to stress about getting insurance at a time like that. So thank you, Amy.
Tammy Graham, and thank you for your work with community radio all over this state. Tammy Graham, fifth-generation Coloradoan professional mediator. I guess you'll be there tomorrow here at Fort Lewis.
I sure will.
When Michelle Obama comes to town.
Absolutely.
New polls, though, say that Mitt Romney, the Pew poll, is ahead of President Obama in the polls around the country. This is Democracy Now! When we come back,